So we're here live at ATTD 2024, and I'm here with Dr. Ohad Cohen. Welcome, and thanks for making the time for us.
Thank you, Rob. Thanks.
Early in your presentation today, you shared a slide that you said you were tired of presenting, you were bored of because it was showing the time and range, and it was making you and your team reconsider the standards of euglycemic control. So
Right.
can you talk a little bit about that and like how MiniMed 780G is contributing to that?
Yes, I wanted to make a point that we should go beyond what we know today. Because what we know today is what we're going to do tomorrow, because the algorithm is very robust. What it did yesterday, it's going to do tomorrow. It's what it did in Europe, it's going to be in the USA. So can we go further now? Now, here's a interesting issue is, why do we want to be in the range of 70 to 180? When actually euglycemia is between 70 to 140. And the reason was that we, as people who treat people with type 1 diabetes, didn't think that people with type 1 diabetes can go to this normal range without the risk of hypoglycemia. Now, we've seen this again and again. The risk of hypoglycemia is gone, or that's, eliminated.
It's the smallest.
It's the smaller on the bar, on the bottom.
Mhm.
Let's go and look at time in euglycemia. And we found, wow, actually people on our 780G system, the improvement in glycemic control is all in the tight target. Let's go there and let's see, can we increase the time spent in the normal glycemia? And I think it's fascinating because we never talked about this. And this is something which is fascinating to promise in the future.
It is exciting because I think, as a person with diabetes, you want to have that tight control. You want to believe that that's possible. And it's great to see, the data that shows that it can be. But there's been an announcement. Obviously, Medtronic is excited about Simplera integrating with 780G, as well as the new insulins, the NovoRapid, Fiasp, and Lumjev approved for the 780G. How, are you excited about, the data that's going to be coming from these new, the new introductions of the insulin?
The whole idea is to get more people to those results. The results are going to be the same results, but those who are a bit reluctant because of the complexity of the G40, now, no reason. So it's going to be easier for them. Those who are really keen on having the shorter insulin so they can inject before a meal, now they can also, all those barriers we want to remove all barriers for people with type 1 diabetes to walk into this euglycemia field. And that's why it's so exciting to increase the indication, increase this, and make it easier for them to use the devices.
That reminds me of something that you told me in 2022, where you talked about the system was really designed for people who have been labeled as non-compliant and who have had difficulty achieving, good outcomes with their diabetes management. 3 years later now, with the system in Europe and the US, are you seeing those results for people who have previously been labeled non-compliant?
So the whole non-compliance has gone up. The indication of somebody, he's not labeling. How come? Actually, it's the technology that solved the problem. So people are not talking about non-compliance anymore.
Yeah.
That's the answer.
My pediatric endocrinologist and I are still friends, and we went out to lunch, and he talked about some of his patients who, didn't even all they could do was change their sites and their sensors. And he said, okay, well, I'm going to give you this system, and all I want you to do is to change your site and change your sensor. And they saw the same results that you.
So really, it's really the talk about non-compliance is the past. Everybody should get to better results. And those who are challenged by not remembering to bolus on time, they'll get slightly less time in range, but they will be in the ballpark, right?
Yeah.
They're not going to be branded, oh, you're the one who never gets into control, A1C high, you're going to get complications. No, you're in the ballpark. You're not in the same, I don't know how it is in basketball.
That's right.
You're not in the center, but you're in the game. That's so important. It's such such a great privilege to bring this solution and get this branding out of the people with diabetes.
I agree. And just kind of as we close, what are you excited that you think our listeners would love to hear about the future of diabetes technology?
So everything is about reducing the burden and getting more people who are more challenged with taking care of them into even better control. So form factor, the new sensor, all of this is important because we want people to feel better with their type 1 diabetes. I don't care, they still complain. Still complain, you get better
Sure.
devices. So first of all, still we remove the burden. Then from the algorithm, if we can eliminate even the need to every time announce, also is going to be those who don't like to announce even get better. So on one hand, getting better results, even those who are not announcing every meal and having it a better form factor. This is where the future is going to see. So more and more people will be enjoying better control.
I'm looking forward to it.
100%.
Thank you so much for your time.
Thank you.
Good to see you.